Hello, my name is Maria Felix, one of the nurses here at Club Tiny Tots, and I will be going over the information regarding influenza vaccination. The three brands of flu vaccines that we can receive this season is Fluviral, VaxiGrip, and AgriFlu. These vaccines are interchangeable. Each dose of the flu vaccine is 0.5 milliliters administered intramuscularly to patients at risk from 6 months of age and older. Pneumovax vaccine is given once in a lifetime and is offered to patients at risk from 5 years of age and older. Each dose of 0.5 ml is administered intramuscularly. The medical indications and lifestyle conditions for free influenza and pneumovax vaccinations are listed here. They include chronic cardiac, respiratory, and renal conditions, just to name a few. Of most interest to us is the children ages 6 to 23 months of age, those who work or live with children from 0 to 23 months of age, and pregnant women in their second and third trimester. What I usually tell parents is that we vaccinate their children from 6 to 23 months of age and everyone who lives with them. It is also important to vaccinate the children who attend daycare.
Count up the number of intramuscular injections from the schedule list. Make sure not to count those patients coming in for intranasal flu mist. And draw up all those vaccines in advance, less about 3 accounting for some no-shows. The reason for doing this is because children are much more fearful when they see you drawing up the vaccine and have a lot of time to focus on the needle. Store all of your preloaded syringes in the refrigerator. Take them out one at a time as you need them.
So you'll need gauze, Band-Aids, and alcohol swab.
In order to document your visit, select from the Oscar forms Flu Shot 2012-2013 or the appropriate year. Make sure that it's for the correct patient. Today's date is written here, and go through the following review of systems: fever, upper respiratory tract symptoms, patient's general health at present, and then go through the specific list of making sure that they themselves have not wheezed today or in the last 7 days, have ever had anaphylaxis, true anaphylaxis to eggs, egg proteins, gentamicin or neomycin, gelatin or arginine, and that they never developed Guillain-Barré syndrome within 6 weeks of having received a flu vaccine. If there are any other significant health conditions, put them there. You can then simply do check all. Please record a heart rate and a respiratory rate and the general impression of whether they look well or ill. Should any of the vital signs be outside of ranges of normal, or if they don't look well, you should not proceed with giving the vaccine. Do a brief cardiorespiratory exam. Document whether or not there are any allergies. Again, these are listed here. And then record which vaccine you've given, as well as the lot number. Please make sure to sign your name for the portion of this form that you completed. In the subject line, it would help to also repeat what vaccine was given, and then click Submit.
The flu and pneumovax vaccines are administered by intramuscular injections. The chart provided includes the needle sizes and the injection sites for the different age groups. It is important to highlight that the needle is to be inserted at a 90-degree angle to the skin. Aspiration is no longer recommended, but it is important to ensure that there is no blood return in the chamber before injecting. In my practice, I prefer to use the 5/8 needles with babies under 6.5 kilograms in the anterolateral thigh muscles, and children from 1 to 2 years of age in the deltoid muscles, and for all subcutaneous injections. I use the 7/8 needles on babies from 4 to 11 months of age in the anterolateral thigh muscles, and children from 2 to 13 years of age in the deltoid muscles. I find that children are less traumatized by the experience if the parent is holding them, or at least holding their hand. Singing helps as well. Here is a video demonstrating an IM injection. Just have her sit right in front of me. It's great.
Should I hold the leg?
No, I'm good with this leg.
Okay.
Okay, anterolateral of the thigh and going at a 90-degree angle. There you go. Okay, Mom, you can hold. Okay. 1, 2, 3. Good girl. That was wonderful.
There are 6 steps in the administration process for FluMist. Step 1. Check the expiration date. Hold the applicator barrel between your thumb and forefinger while you examine the applicator for expected color, clarity, sediment, and expiration date as described in the package insert. Do not roll the sprayer in the palms of your hands. This can cause the dose divider clip to separate from the sprayer. In addition, do not depress the plunger yet. This will cause vaccine to leak out from the applicator and an incorrect dose to be administered to the patient. Step 2. Remove the rubber tip protector from the end of the sprayer. FluMist should not be injected or outfitted with a needle. Tell your patient to breathe normally. They do not need to actively inhale or sniff FluMist. Administration of FluMist does not require any special action on the part of the individual being vaccinated. For young or apprehensive children, it is advisable to provide some support of the head to avoid inadvertent jerking. For example, the child might sit on a parent's lap, or you might place your hand on the child's head. Step 3. While the patient is in an upright position with head tilted back, place the tip just inside the nostril to ensure FluMist is delivered into the nose. Step 4. Depress the plunger as rapidly as possible until the dose divider clip prevents you from going further. If you push the plunger slowly, no mist is created. To achieve the necessary fine mist, you must push the plunger rapidly. Step 5. Pinch and remove the dose divider clip from the plunger and discard it. Step 6. Place the tip of the sprayer just inside the other nostril and rapidly depress the plunger to deliver the remaining half of the vaccine. Of the total dose of 0.2 milliliters for administration, approximately 0.1 milliliter will be administered into each nostril. After administration, dispose of the sprayer in an impenetrable sharps container. Tissues may be provided to the patient following the administration of FluMist. Let's review again the steps for administering FluMist one more time. Step 1. Remove FluMist from the refrigerator and check the expiration date on the sprayer. Step 2. Remove the tip protector. Step 3. Insert the sprayer into first nostril. Step 4. Rapidly depress the plunger until you are stopped by the dose divider clip. Step 5. Pinch and remove the dose divider clip and discard it. And Step 6. Insert the sprayer into the other nostril and rapidly depress the plunger to deliver the remaining vaccine. Dispose of the used sprayer in an impenetrable sharps container.
So after giving the vaccine, you write in the book what you've given. Just get in the right thigh, 0.5 IM, and you sign. After the vaccines have been given, I usually advise parents to give tempera in case of fever or severe irritability. Temperature of 38.5 degrees rectal or 38 oral is considered a fever. Patients have to wait 20 minutes in the waiting room after vaccination in case of a reaction. For patients under 9 years of age, receiving the flu vaccine or FluMist for the first time, they require a second dose in 4 weeks. The second dose is not required if the child has already received a dose of the flu vaccine in the past. These are the handouts we give to parents which explain the symptoms and complications of the flu and the side effects of the vaccine. I usually highlight common side effects such as redness or swelling at the site of the injection, fever, malaise, and joint pain, especially in children who are receiving the flu vaccine for the first time. This is the handout for the Pneumovax, which explains the symptoms and complications of the pneumococcal infection and the side effects of the vaccine, such as redness or swelling at the site of the injection, fever, muscle pain, and headache. So you'll wait 15 minutes outside just in case there's a reaction, okay?
Thank you.
Have a good day.
You too. Thank you so much.
Thanks, Mom. I'd like to go over the medical emergency procedure here at Club Tiny Tots. If a child presents as unconscious, unresponsive, having an anaphylactic shock, difficulty breathing with shortness of breath, bluish lips or complexion, and/or serious physical injury, first we ask the parent to stay with the child. The staff member who is first on the scene of the emergency situation will be the designated ER assistant. The ER assistant is to ask reception to announce Dr. Stat to the room or area where the child is located. This will mobilize the designated doctor and nurse. If the doctor does not arrive within 15 seconds, they are to be repaged overhead every 15 seconds until they arrive. If the nurse does not arrive, they are to be repaged every 15 seconds until they arrive. Ensure ample space around the child and enforce crowd control. Request assistance from reception and other PAs if needed. The designated doctor and nurse is to attend to the emergency immediately. The ER assistant is to grab the emergency kit and oxygen tank stored in the nursing room and bring it to the child. If the child is not already in a suitable exam room, the ER assistant will identify the nearest available exam room. If deemed appropriate, the child will be moved to the room. The ER assistant is to stand by for any instructions to assist the doctor or nurse. If the ambulance is called, the ER assistant is to wait by the clinic entrance and guide the first responders to the child. So the emergency kit is in the nursing office underneath the sink. We have the box of ambu bags. We have 3 different sizes. This is the oxygen tank. To turn it on, you turn it towards the plus, which is to the right. You attach it here, and you bring it to the emergency scene this way with the emergency kit, the red tackle box.